Hello, everybody. Well, I have a question for you. Do you know what your vitamin D levels are? And did you know that over 1 billion people worldwide are vitamin D deficient? My name is Dr. Arinola Dada. Welcome to the Healthy Joints, Healthy Lifestyle Show. And for those who don't know me, I am a rheumatologist and I help people with joint pain become pain free and people with autoimmune disease get their immune system back on track. So let's dig right into this. Vitamin D, that's a sunshine vitamin, we all remember, right? But did you know that as we get older, we depend even more on vitamin D? Not only is it important for our bones, I treat osteoporosis all the time, so it has a special place in my heart, but also important for our muscle strength. But strangely enough, important for cognition, so how we think as we get older, and even for stability. So this sunshine vitamin has a lot of work that it does, right? So as we get older, not only do especially women, as we get older, we tend to run a risk for osteoporosis where our bones get thinner. And calcium, vitamin D are both important for strengthening and maintaining the bone integrity. And so when we see patients in our clinic, we do a bone density test. And I know it's always, people always say, how painful is that? It's not painful at all. You lie on an exam table and the scan goes over you and it pops out the results, and it doesn't even have radiation that's significant, any more significant than the environment, because the person doing the test doesn't have to wear a radiation beam counter, right? So back to vitamin D. So calcium and vitamin D is important for building our bone density and supporting the bone structure as well as muscles. So if you've been diagnosed with osteoporosis, though, and your doctor is talking about medication, the very basic thing your doctor will do is check your vitamin D levels. Because if your vitamin D levels are low, your doctor won't find out why. And if it's low, your doctor will probably recommend a supplement. I live in the greater Seattle area. Most of us, an epidemic of its own, that we all have low vitamin D levels because your body can make vitamin D from the sun. And some people may say, as I digress, that yes, well, just go lie in the sun and you get some. My very good friend is a dermatologist. If she hears that, she's going to run screaming from the room. So, yes, you get the vitamin D from the sun, but depending on your complexion, you may be at risk for skin cancers from being overexposed to the sun. So, there is a fine balance somewhere. I read it in the literature that about 20 minutes of sun exposure, but it depends on the intensity of the sun, right? And it's not the same for different different skin tones and pigments. So vitamin D, interestingly, there was a study that came out and actually looked at autoimmune diseases and found that people who are vitamin D deficient may be at an increased risk for autoimmune disease. Now, I thought there was some question about whether or not it didn't quite pass the complete smell test, but it looked like there was a trend for sure. So it definitely is not like, oh, you're vitamin D, you're going to be D deficient, you're going to develop an autoimmune disease. No, but there was a trend that there's a higher incidence of autoimmune disease in people who had low vitamin D. So it makes sense to try to correct this. But, I know that sometimes, because, they've heard Dr. Dada talk about low vitamin D, people are just going to go gorge on vitamin D. And if you do, there are problems with having too much vitamin D in your system too. So it's a good idea to at least get it checked with your doctor, because it's not a one size fits all. Some people may not absorb vitamin D as well and may need to get like injections of vitamin D, for instance, right? And so it's not a one size fits all. And some people, if you have too much vitamin D in your system, you can kind of feel nauseated and you may have headaches, and it may even cause you like some kidney problems where you're peeing out a lot of calcium, because calcium and vitamin D kind of go hand in hand a lot of times. So as much as vitamin D is amazing, I just want to emphasize that balance is important. So Vitamin D does have its controversies, right? There was a study that kind of looked at whether or not vitamin D supplementation could improve things like heart disease. And I think that was totally controversial. And I think the jury is still out on that. So question is, well, how can you get enough vitamin D? And here's the rundown. Some sun exposure, but be careful of your friendly neighborhood dermatologist who would be concerned about that. Foods. So whether it's salmon, eggs, fortified milk, if you are a vegan, you may just run the risk. And I guess if you're in a place like that, doesn't have a lot of sun, you may run the risk of being vitamin D deficient. And so probably supplementation is a good idea for you anyway, right off the bat, because most of the foods are animal products that would give you the vitamin D. So, in the Pacific Northwest, I typically tell my patients we're running between 2,000 and 4,000 international units supplementation for vitamin D. Although in other areas, the recommendations can be somewhere between the 600 to 800 international units of vitamin D. So I just want you to remember that it's not a one size fits all, that vitamin D is your partner for healthy aging as we have, and to make sure that you continue to maintain stronger bones. Remember, we are all expecting a higher quality of life, right? And we're getting old. As we get older, we're living longer. And the whole point is to make sure that when we're 90, we're still able to go for walks, we're still able to go to grandchildren's baseball games and soccer games. And what helps us to do that is increasing our joint health and mobility. So I hope this is helpful. You can get vitamin D from foods. If you need supplements, talk to your doctor. If you're a vegan, you should be taking supplements automatically because the natural ways to get it may be limited to you. And then sun exposure for 20 minutes is helpful, but you have to be careful because you have to think about your skin and the risks of skin cancers. So thank you for watching. If you think this video has been helpful, thumbs up, subscribe to our channel, share it with a friend. You take good care, and I'll see you next time. I think we're going to be talking about turmeric next time and how it improves inflammation. You take good care. Bye, everyone.